Welcome to the Community Forum. My name is John Gogliettino, and I'm your host. This evening we're going to be talking about a subject that's dear to my heart, chiropractic. I'm a lifelong chiropractic patient. I firmly believe in it. It helps me in my particular areas, but we're not talking about me. We're talking about Chris Mascetta. He's got a practice in Ridgefield. I have known him for a while, and he's going to be talking about chiropractic, some of the things that I already know about, but you don't know about, and some new things also. So welcome to the show.
Thank you very much, John.
You're welcome.
For inviting me here tonight.
Yeah, you're welcome. Now, for those that have never dealt, and there might be 15, 20% out there that have never dealt with a chiropractor, what is chiropractic? Aside from, it seems like most people know it's that profession where they take out the, and it goes pop, crack, pop, whatever, you know what I'm saying.
Right.
You have pops and noise.
Popcorn.
It's like pops.
Popcorn.
You adjust something and it pops.
Right. Well, chiropractic is a form of healthcare that's natural in nature, and it allows the body to heal itself. We look to the spine. I brought one of the spines with me here, and if I lift this up, this will be good. So we're the type of doctor that primarily looks to the spine, and we'll look at the extremities as well. A lot of problems maybe start in the feet and the legs and whatnot, but we're going to primarily talk about the spine tonight. And we look for a condition that's called a vertebral, meaning vertebrae, one of the bones of the spine, subluxation complex. And subluxation means a vertebrae that's slightly misaligned mechanically, complex meaning that it may be more than one. So the consequence of this is that these are fine mechanical joints. So if they're not lined up properly, their weight bearing is going to be altered, their movement is going to be altered, and that's going to affect the soft tissue around them. Now, the number one thing that's affected, and really what makes chiropractic different than other healthcare professions, is how it affects the nervous system. Okay, and the nervous system, which consists of the brain and the spinal cord, and then the nerve roots, which are the nerves that come off the spinal cord, controls every cell, every tissue, every organ in the body. So if the nervous system's not functioning properly because there's a nerve slightly out of position, there's a bone slightly out of position putting pressure on the nerve, it may not necessarily cause pain, but it's going to cause dysfunction. So wherever the information from those nerves go to those cells and organs, they may not be working at 100%. They don't work as efficiently as they should, and that may reduce your overall health and well-being of the body. But again, remember, these are mechanical, so if the weight bearing is altered, the disc material might start to break down. It gets thinner. It's made of cartilage, and it relies on movement and proper weight bearing. That's the first tissue to really start breaking down. You could have permanent changes in a disc within 6 months of a subluxation. The other tissues are...
And something like that could happen like in a car accident.
Absolutely.
You're out of line, and it doesn't get corrected, and within 6 months you start to have changes because it's been out of line, and no one sought any help for the, they got hit a certain way, and the conventional thing that you find in America is take a pain pill and it'll go away maybe in 6 months.
And it's the furthest from the truth, really, because again, these are mechanical joints, and if they're not lined up properly, especially the force of a car accident. I work on a lot of car accident victims, unfortunately. It's good for them because we really can fix them for the long run. But if you have a weakened disc, and you get hit either from behind or you hit somebody in the front or you run off the road, that disc can really squeeze out and push out and pinch on a nerve. And anybody with a herniated disc, chiropractic is a great choice because we can get that disc into a better position.
And the next, which is an area that I have,
right.
The same thing, you've got the same situation.
Absolutely.
Now, I got a little ahead of myself, but
Sure.
Where did you go to school for this chiropractic? How did you get into it?
How do I get into it? Well,
Yeah.
I went to undergrad at SUNY Cortland, State University of New York at Cortland, and I was a health science major, completing my pre-med requirements because I wanted to become a medical doctor. And I think the health science program, every pre-med student should take, because the pre-med is typically just a biology course. Health science, you had to take anatomy and physiology, you had to take microbiology, you had to take chronic and communicable disease, and we learned about all these different conditions of the human body. We took a lot of pathology. And part of it was also community health. And we were learning about all these millions of people. Now, they were talking about in the early 90s, tens of millions of people that were uninsured. And the reason they're uninsured is because, and it's not much different than it is today. The reason they were uninsured is the healthcare is so expensive that a lot of people, health insurance have to charge a lot of money, and a lot of people couldn't afford it. And the solution that I was learning about that was preventative health care. Society should take better care of themselves and live healthier lives so they get sick less and they don't necessarily need to rely on the healthcare system.
And then the bills aren't that large, they're just large.
Exactly. It just makes sense to stay healthy so you don't have to rely on the system. But I was looking into medical school, and I work closely with a lot of medical doctors, so I don't want to make it seem like I'm knocking medicine, but when I was looking into medical schools, it was really more about reactive care. Once the people get sick, once the people get injured, that's where the healthcare system, it's really a sick care model. What I liked about chiropractic is it's all about prevention. Yeah, absolutely. It's about looking for misalignments of the spine, correcting them very efficiently. Chiropractic is probably one of the least expensive forms of healthcare there is for the benefits of it. I was an athlete at one time, may not look like it anymore, but I was an athlete, so I was really into
basketball.
Actually, I was a track runner. I raced. I ran track, and a lot of people don't realize this about me, but I also raced motocross for a long time.
Really?
And
I didn't know.
Yeah, a lot of people are like, whoa, a motorcycle racer. But talk about knocking your spine out of alignment. So, the philosophy of chiropractic is first to keep people healthy and to show them how to improve their overall lifestyle, healthy lifestyle, so that they remain healthy. So that's really what interested me in becoming a chiropractor. And then I headed to Dallas, Texas, and I went to Parker College of Chiropractic. It's a doctoral program. A lot of people don't realize that chiropractors are doctors, and in the state of Connecticut, we are a primary level care physician, really. So if you hurt your back or if you have headaches, you can go to the chiropractor, and they can diagnose the problem and recommend a course of treatment. And in my office, first thing we do, two things. Number one, we do a full history and exam because I want to know, is this something I can help you with? Is it a chiropractic case? If it's not, we will...
You'll do a referral.
Absolutely. And I have a lot of local medical doctors that I trust very closely, and that's who I'll refer to. And then number two, if it is something I feel as if I could help, make a diagnosis. What is it? And really fully explain that to the patient and how we can help them with chiropractic.
Now, you have a certification.
Yes.
And in sports... in the sports area, right?
Yes.
Can you want to explain that certification?
Yeah, I did a board certification through the American Board of Chiropractic Sports Physicians. So the title is a Certified Chiropractic Sports Physician, and it's 150 credit hours over and above the doctorate degree. And it's the study of sports injuries, really, the diagnosis, treatment, and prevention of sports injuries. We go a lot more into, we get a lot of biomechanics in chiropractic school, but we dive a lot more into the biomechanics and the orthopedics of sports injuries. And, my practice is, I would say, mostly a family-style practice. But we do get a lot of sports injuries. It's also an interest of my own, so I thought that certification would be a great thing to do, and I'm certainly glad that I completed it. I've had it for a few years now, and seeing a lot more athletes, and it could be the little league player to
high school,
college, and I have a lot of professional athletes. I mentioned motocross earlier. I have a practice that's specifically just for the motocross profession, and I started working with amateurs, but now I work with some of the top riders in the world, and and it's a whole other avenue that I'm going and hope to see blossom. But this weekend I'll actually be at. If anybody knows anything about motocross, there's what's called Supercross, and there's a Supercross at Giant Stadium, MetLife Stadium this weekend. They're expecting over 65,000. They're going to sell at the stadium.
And you're going to be in the thick of it.
I'll be in the thick of it. I'll be working with a lot of the riders and getting them ready to get on the bike and race, and hopefully improve their performance and keep them safe and hopefully reduce the risk of injury.
Okay. We were talking about the subluxation,
Right.
and what are the most common injuries? Is L1 constantly, because that's what I've got.
That's what you have, L1.
Is the L1, and then I got the neck thing that I'm not sure if it might have been when I was knocking my head out like an idiot when I was in high school.
Right.
I was trying to play ball. I was too short to
Right.
play, but I was out there anyway.
Right. Yeah, it depends on the region of the spine.
Yeah.
There should be three curves of the spine. When people think the spine, they think it should be straight, and they're correct. If I look at you from the front or from the back, it should be pin straight. Looking at you from the side, the spine should look like an S. It should look right. So you curve in the neck, a curve in the mid-back, and a curve in the lower part of the spine. A lot of times we lose that curve in the neck, and that puts a lot of pressure on those mid-cervical or the mid-neck bone. So the most common bones in the neck to wear are the C5, C6. Now, people with headaches, a lot of times it's the C1 and C2. That's all the way at the top. These nerves that...
Right underneath where the brain sits.
Yeah, right where the skull sits on the spine.
Right, that's what I mean.
And there could be a lot of tension in there. It makes these muscles that are called the suboccipital muscles tighten up, and you have a nerve that comes out of there that is called the lesser occipital nerve, and that travels all the way up into the skull. When these muscles get tight, it puts pressure on that nerve and makes all the muscles of the skull get tight.
Believe me, there's nothing lesser about that one.
Yeah, yeah.
You call it the lesser.
Yeah, that's it causes the greater headaches. And chiropractic people don't realize, but man, some of the best results we get are with headaches when we start loosening all this up and get the mechanics and the weight bearing.
Yeah.
But the C5, which is right around here, that wears out a lot. You were asking about the lumbar spine, and lumbar spine is usually much lower, the L5, S1 area. There's just a lot of pressure, and those discs can wear out and put a lot of pressure on the nerves. So we do a lot of work down there as well.
Where's L1 again?
Well, L1 is this light blue. So that's
okay.
L1, 2, 3, 4, 5, and then it becomes the sacrum. And these L4, L5, those, as far as low back pain, that's probably the most common area to have problems. But certainly we see them, throughout.
I didn't know that. I don't know, I thought L1 was like the bottom of the pile.
Right.
But that's the bottom of the...
Well, you have S1 down there. Maybe that's what you're thinking. They start with the numbers again once it goes through a different region of the spine.
Yeah. Okay. But now I know better where the one is. Okay. But anyway, it does work for me, and I was hearing all kinds of, well, you're probably going to end up with this or whatever, or that. You got to go to this surgeon or that one in the next 5 years or whatever. Right. Well, that was when I still had hair, and it was still all dark.
So chiropractic helps you with your overall health and the spine.
Right.
And that's the idea. We want to do things as conservative as possible. We want to avoid more significant type of procedures, and not to say that I don't recommend patients go see surgeons, but most of the time we can reduce the likelihood of that. And it does. I tell patients, look, we're looking at you now, but I'm also looking at what you're going to be in 40 years, and we want to really slow down the level of degeneration. So hopefully they'll never need a surgeon or go on medications for these things.
Now, how does chiropractic differ from physical therapy?
Okay, and that's a great question. And a lot of people see it as the same. And I'm a big fan of physical therapy. And I think that chiropractic and physical therapy work beautifully together. We specialize in certain things and they specialize in certain things. And the combination of the two works very nicely. But it really goes back to the primary philosophy of the chiropractor of correcting the subluxation to improve neurological function. And physical therapy is more about core strength and strengthening the muscles. Not to say that we don't do that, because I give exercises every day and I work with patients on exercise, but it's primarily about correcting the segmental function of the spine, correct the subluxation, improve that neurological function. And everything else really is a symptom of that, whether it's a degenerative disc or a muscle spasm or a pinched nerve. All those things happen. We're getting to the foundation of the spine. So, you can go to a massage therapist. And again, I love massage therapy. And we have massage therapists in the office. But they're working primarily with muscles that may be in spasm. Well, that's a symptom to a nerve being pinched and the muscles getting tight. Well, the foundation being altered and the muscles being asymmetric. So it's a good thing to do, but it's not fully complete. And then the next level may be physical therapy, where they're stretching the muscles and they're strengthening the muscles. But again, those muscles may be dysfunctioning because of the spine. And not to say that they don't work with the spine, but nobody does it as specific as a chiropractor in correcting that subluxation, improving the function of the nervous system so that the whole system works better. We all work beautifully together, but really
take an effort to straighten that whole thing out as opposed to just doing part of it.
Yeah, absolutely. And I feel that everybody does have their part, but yeah, if you don't correct the underlying structure, then you may feel better for a while, but inevitably it'll probably come back.
Now, there's a number of benefits from the chiropractic, but I also see the next point, which is ear infections.
Right.
Are another thing that gets benefited by chiropractic.
Right, absolutely.
And you're thinking, well, here's the neck and here's the ear. So how the heck does it go from the neck to the ear?
Where's the connection?
So where's the connection?
And it's funny because a lot of people are really surprised by this. And again, it's unbelievable, the results. It's a matter of drainage. And what happens is with children who get a lot of upper respiratory type infections, a lot of fluid building up, and it's not draining properly. And it's a matter of the eustachian tube, which goes from the middle part of the ear down really into the back of what's called the nasopharynx, kind of the back of the throat. And up to about the age of 5, that tube is more horizontal.
I see.
As you get older, it gets more inferior and it improves the drainage.
Right.
But a lot of it starts with, again, the upper cervical spine. If you have a misalignment of that first and second vertebrae, it puts a lot of tension and well, first of all, it reduces the function of the immune system. Okay, so we correct this to stimulate immune function so that the child is improved immunity and they better fight the infection. But when we correct the subluxation of the upper cervical spine, which we can do very gently, a lot of people, oh my God, it's my child. I don't know if I want the neck adjusted, manipulated. But the thing about chiropractic, it doesn't need to be forceful. It's very specific, very gentle. It's a quick thrust. You don't necessarily need the popping and cracking. And in children, a lot of times, that's the way we do it, very, very gently. But when you manipulate those bones and then work with a lot of the soft tissue, if you look at an anatomy book, there are small little muscles that are very closely related to these upper cervical vertebrae. And they attach to that opening, very close to the opening of that eustachian tube. And when we start manipulating and mobilizing those vertebrae, it affects those muscles, loosens them up, and allows drainage. And there's also a lot of drainage techniques. And I can't tell you the amount of children that I've worked with that have been on antibiotics their entire lives. Once we start adjusting them and working with them, and the number of visits varies depending on their overall health and well-being, but I would say 9 out of 10 children that I've worked with, we've gotten proper drainage. I mean, for an example, I had a family
they've gotten off the...
Absolutely,
yeah.
Absolutely. And then we work nutritionally and say, these types of things might cause some inflammation and fluid, so that helps as well. But I can't tell you how many children, like today I had a 7-year-old in, and his mother was telling me, this is the first winter that he's never needed an antibiotic. And not only that, but it's the first winter he's not had an ear infection. And boy, when you do that, you're getting these children off these medications. Again, it's not that medication's bad. We just want to limit how much they're used. And with the antibiotics,
when they really need it, they're not going to work.
Exactly.
So
exactly.
It's better to take care of something that you can take care of this way than have it, 5 years down the road or whatever, not have it work because he's had too much.
It's a big problem in the hospitals today. So, but it's you hope that things are going more in a natural direction.
And we talked about the headaches already.
Right.
That's been the big benefit for me. And how has it benefited for herniated disc? We've already talked
a little bit about that.
We already talked a little bit about that.
But it's really about the herniated disc, which is the cartilage between the vertebrae. And if you've got misalignment and a lot of pressure being put on that disc, it's going to keep squeezing it out. And there's so many different ways to adjust the spine. Again, people may be nervous to go to the chiropractor if they have a slipped disc, but there's so many gentle ways that we can have an effect. And in my office, we have traction tables, what are called intersegmental flexion distraction tables. And the patient will lay prone, the back part of the table goes up and down, I hold onto the spine, and it very simply opens it up and takes the pressure off the disc, creates a negative vacuum on the inside, and pulls that disc ever so slightly into a better position. But it also takes the pressure off the nerve and the joints, and with proper exercise and program of chiropractic care, it really does wonders. And it depends. Some herniated disc takes a really long time. Other than working with somebody, he came in with a pretty significant disc herniation. 2 weeks later, we've had him in really, really great shape. Sometimes it could take a couple of months to really get them back into shape, but it works beautifully.
Now, there's been some discussion about the chiropractor can be dangerous, particularly the neck. I guess there was something a while back, there was a controversy about that, and there's still some chiropractors that won't adjust the neck. Is there any truth to that, or is there, you just got to be a little easier on that particular area, right? Right,
yeah. Well, chiropractic is very safe. It's probably the safest and most efficient and effective form of healthcare there is. And sometimes we get a bad rap, and we've had a bad reputation, which is, it's a lot like playing telephone as a child. If something happens, and then as the story passes on, it gets really
worse.
Blown out of proportion.
Yeah.
But a lot of people are very surprised when I talk about how inexpensive my malpractice insurances. I think I pay less than $2,000 a year. The reason being, it is very, very safe. Now, if there was any risk to injury or paralysis, or the stroke issue was really hot in Connecticut a few years ago, our liability insurance would be through the roof. We probably wouldn't be able to afford to be in practice, most chiropractors. But it is very safe.
And that is very inexpensive, being in the insurance field.
Right,
That's a low number.
It's unbelievable. I'm in full practice for
Yeah.
almost 15 years, and the whole stroke thing, it's really been put to rest. What they feel is, chiropractors were getting blamed for causing strokes, and what they found is that it wasn't necessarily the chiropractic that caused the stroke, but the patient may have gone to the chiropractor with a headache and a stiff neck. We're in the process of having it. They may have gotten an adjustment, go home, the stroke happens. It would have happened one way or the other, and the studies really do show that there's an even incidence of whether they went to the chiropractor or their primary care physician. They went to the primary care physician, stiff headache, they miss it, they go home, have the stroke, same thing with the chiropractor. So it's not necessarily the procedure that was done. And I hate to see the word misdiagnosed, because it's a very difficult thing to the type of stroke that we're talking about to diagnose. But it's been pretty much ruled that it's not something that's, it's a possibility. But
Who should see a chiropractic? Just about anybody, or you get to a certain age, in other words, if you're 82, you don't go because the bones are getting too brittle at some point in time, or
everybody would benefit from going to a chiropractic, especially anybody who wants to improve their overall health and well-being. Chiropractic is a great choice for them. Anybody who has a subluxation, obviously you don't know you have a subluxation unless you go to the chiropractor, because a lot of times they may not be causing symptoms, like going to the dentist. And for your cleanup, I'm like, oh, you have a cavity. I didn't know I had a cavity because it wasn't causing any pain. You have it taken care of, and you're fine. So anybody could really have a subluxation. The only way to find that out is by going to the chiropractor. So any age, we work on very little, like infants and babies. And people may sound, well, why would they need it? Well, the birth process can be very traumatic. As they start learning to walk, a lot of tumbles and falls, and it's a great thing to start when they're young to correct subluxation, and so that they can develop without them. And up to elderly. I was with a patient today who was 92, and chiropractic care will vary. Obviously, I'm going to adjust an infant and somebody who's 92 much different than I might you.
Yeah.
Very gentle. It doesn't need to be forceful at all. We have specialized instruments that are very specific and very quick. We have tables that have what are called drop pieces. So if your pelvis is misaligned like this, we cock the table, I push, the table drops and sets the joint. It's about stimulating the nerves to inhibit the pain and to improve the function. So.
Yeah, and you've also got devices that sort of like set your spine a certain way also.
Absolutely.
Yeah. Do you have a website, by the way?
Yes, we have www.ridgefieldchiropractic.com, and it describes the office.
And you have various information there.
Yeah.
If somebody wants to find out a little bit about the
subluxation and the practice. It's very informative. It's all research based. So if you have a question like ear infections, you can put in ear infections, and all clinical literature will come up on the effectiveness of chiropractic. But my practice is an integrated wellness center.
So you have different disciplines underneath the...
Yes.
Yeah.
So it's primarily a chiropractic office, but we have an acupuncturist who also does a lot with herbs. And his focus
These are all the natural...
natural remedies, yes.
And the same, the idea of being proactive, take care of the problem, take care of future problems before they happen.
Yes, absolutely. And finding the underlying problem and taking care of it as naturally as possible, and referring out if we need to. And we also have another chiropractor that does functional medicine in the office, which is a very interesting field. It's a matter of doing blood work and different lab analysis and looking where somebody may be deficient and correcting it with nutritional supplements or herbs or whatnot. And then we have two different massage therapists, one that does more therapeutic massage, and the other one has got a lot more advanced training. She does what's called craniosacral therapy and lymphatic drainage, and she works with some different instruments, and very effective at improving your overall health and well-being. So we really hope, we look to see if we
And it speaks to what you were saying before, that you work with all these other disciplines and giving you a complete product, so to speak, if you want to call it that. In other words, you've had your back worked on, adjusted, now do this in between because you can only adjust so many times.
Right.
It's not really good to adjust 15 times a month, a couple of times a month, and then maybe have something else done in
it depends
between.
on the condition. Someone's got a herniated disc, they're going to see, or a car accident. Yeah, we might see them 15 times in a month, but most people don't need that, and we can really do it.
Well, when they're past their injury, it's more of a maintenance. That's the word, isn't it? Like a couple times a month, and then if they need more, they can see the massage person or whatever.
Absolutely. Or if they're not responding as well as I would like them with the chiropractic, we've got the acupuncturist there. Or maybe there's a nutritional deficiency, so then we could do some lab analysis, very detailed lab analysis, find out maybe that they have some deficiencies. Bring that up with some supplements or some dietary changes, voila, they may be doing a lot better. Also looking at ergonomics and stress in their lives. And, it really is a full picture. As a chiropractor, I think it's more physical stresses, but it can maybe be chemical or emotional and nutritional as well. And in my office, we can take care of most of that. And if not, we've got the right referrals in the medical field that can help out.
In the last couple of minutes here, what's your future directions?
Well, obviously, I would like my practice to continue to grow. I would love to see it become the #1 wellness center in this area, integrated wellness center. And I call it, you see a lot of integrated medicine. We're not really integrated medicine because we don't have a medical doctor on staff. Maybe one day we will have a medical doctor on staff, but we really are dealing with wellness services, the chiropractic, the nutrition, the acupuncture, the massage. So I would love to see that continue to grow. I would also love to see the motocross practice continue. Like I said, that is a completely separate. And next year, I hope to be traveling the country. Maybe in Washington State one weekend, in Texas the next, and back into New York.
And you'll have coverage in the office.
I'll have coverage in the office, and I'll be traveling, working with the top motocross riders in the world, and it looks as if I'm on track for that. And so it's very exciting. It's a sport that I love. I've loved it
I was
since
going to
a
say,
child.
so you're dealing with the sport you love, and at the same time you're also doing the occupation that you love.
Yeah, it's great. It's a great way to marry the two. And anybody who's worked in professional sports, to be behind the scenes with these elite athletes, and it's neat because the elite athletes, compared to amateur athletes, the elite athletes are seeing somebody like me to improve their performance, where in amateur athletes, they usually hurt themselves and then come in to get the injury treated, and we try to educate them on the importance of prevention and how this might improve their overall performance. But the elite athletes is about making them better, and motocross making them faster and reducing the risk of injury. So
they're giving me the high sign. I want to thank you for coming on the show.
Thank you very much.
And I want to thank the viewers for tuning in to Community Forum. Tune in next week, same time, same station, and we'll have another interesting program. Good night for now, and we'll see you then. Okay, so now we're on and we got to sit until...
Okay. Thank you so much for the opportunity. I mean, it's just fantastic. Really, really enjoyed it. Sure.
Does all the doctors in Ridgefield have all the big time deals come to their places? Like you got the motocross people?
Right. Well, I know that there's an eye doctor in town who's done a lot of work with the Yankees.
Yes.
Right.
I go there.
Oh, okay, so you know who that is, right?
That's why I asked that question.
Yeah, absolutely.
My brother-in-law saw Joe Torre. He walked in. Joe Torre was there.
Isn't that amazing? Yeah.
We done?
Yeah, we're done.
Okay.
Okay. Excellent. Thank you so much. That was a blast. Boy, it does go fast.
Yeah.